The very reason for me joining back this institution is the topic for fourth technical session, medical education and creating rural healthcare professionals. If you look at the distribution of 130 crore population of India, 70% of the population are situated in rural area, whereas 30% of the population are situated in urban area. But if you look at the healthcare professionals, 70% of the healthcare professionals are in urban area, whereas 30% of the healthcare professionals are in rural India. Ironically, if you look at the statistics of disease and mortality, 70% of the communicable diseases, infant mortality, maternal mortality is present in the rural area where we don't have minimum basic facilities. This being a rural hospital, it has indeed been my great privilege and dream to work in this hospital, as we don't have any numbers and targets, and we can truly concentrate on treating the poorest of the poor and last mile connectivity. So it is not only the state of the art infrastructure and facilities that we need to have, but also the state of the art, one of its kind in the world, wherein medical education and healthcare professionals will be of the rural, by the rural and for the rural. Now this warrants the need for us to have an AV on the fourth technical session, the medical education and the beauty of creating rural healthcare professionals. Can we have the video, please?
Health is a basic right of everyone. Healthcare. Right to good health is a basic right of every human born on this planet. With this idea, Sadguru Sri Madhusudan Sai embarked on the mission providing compassionate, quality and free of cost healthcare, starting with the heart by addressing the global burden of congenital heart diseases in children. First dedicated totally free of cost, Sri Sathya Sai Sanjeevani Center for Child Heart Care was established at Nava Raipur, Atalnagar, Chhattisgarh in November 2012. In November 2016, the second Sri Sathya Sai Sanjeevani International Center for Child Heart Care and Research was inaugurated by the Honorable Prime Minister of India, Mr. Narendra Modi, at Baghola, Palwal District, Haryana. The third hospital, Sri Sathya Sai Sanjeevani Center for Child Heart.
So, as I call out, we invite the distinguished panelists on stage, Dr. Bhaskar Rao, founder of KIMS Hospital. A legend in cardiology, Dr. Bollineni Bhaskar Rao is one of the very few cardiothoracic surgeons in the country who performed over 30,000 surgeries in his career spanning over the last 25 years. The brand KIMS under Dr. Bhaskar Rao is a 1,000-bedded institution with South India's largest healthcare facility under one roof. Moreover, Dr. Bhaskar Rao was instrumental in formulating Rajiv Gandhi Arogyasri scheme. Next, we have Dr. Rajesh Mishra, the President of Indian Society of Critical Care Management. Dr. Rajesh Mishra is a staunch academician and the leader in the field of critical care medicine in India and SAARC nations. He is one of the pioneers, a strong proponent of closed ICU system and cost-effective management to critically ill patients. He is currently the President of Indian Society of Critical Care Medicine and Chancellor of Indian College of Critical Care Medicine. Dr. Vinky Rughwani, Founder President of Thalassemia Society of Central India. Dr. Vinky Rughwani is a pediatrician and founder President of Thalassemia Society of Central India. Is working for welfare of thalassemia and sickle cell patients and prevention of this illness in the country, especially in the central part of India since more than 22 years. At last but not the least is our panel moderator, Dr. G.V. Ramana Rao, Director GVK Emergency Management and Research Institute. Dr. Ramana Rao has 30 plus years of medical professional experience in education and research in public health, emergency medical services and geriatrics. He has served as a professor of epidemiology and reproductive health studies and is currently director at GVK Emergency Management and Research Institute. Over to you, sir, Dr. G.V. Ramana Rao.
Very good afternoon to all of you. On behalf of the panel here, I just wanted to thank the organizers for giving this opportunity to discuss on a very important aspect of the aim of this conference. Morning we had very interesting discussions on the technology, diagnosis as well as the pharmacy also. Now, I'm sure you will all agree with me that health is a manpower-oriented industry and doctors play a very key role. To supplement what it was mentioned by the organizers, that 1826 was the year when the first medical college was started in India in Mumbai. Now we look into this situation. 13 lakh MBBS doctors are currently working and about 1.3 other healthcare professionals are there in our country. Almost equal number. While the World Health Organization has stipulated that there should be one doctor for 1,000 population. And it has also mentioned in some of their literature that there should be at least 44.5 total team of healthcare providers for 10,000 population. So what I want to bring that there are some standards. About 80,000 young medical graduates can be turned out from our medical schools currently. 2018 was mentioned as a year when India has accomplished the WHO norm of 1:1,000. But there are some controversies. You may be always, I think many of you may be aware that the National Medical Commission has come into vogue and two things have come up very recently. One is Indian medical doctor, and they have also identified the competency-based education should be the future, how we will be able to create doctors who would be able to become good clinicians, good communicators, good leaders, and good professionals. And there may be scope, as we have experienced since 1960s, that Indian doctors are well recognized all over the world also. Now coming to the access of doctors, as alluded, if majority of the doctors are in the rural areas, how we will be able to bridge that access gap is one challenge. Second is to create a pool of adequately trained doctors is another challenge. What I'm looking at is the entire spectrum of medical education, which is government, private, non-government and international also. So let us try to use the strengths of a very strong panelists here. When I was interacting with them in the last 24 hours informally, all of them have got experience in these sub-themes of today afternoon discussion. So I will first ask Dr. Bhaskar garu, who is heading the famous Krishna Institute of Medical Sciences, and he not only excelled in post-graduation, he not only excelled in creating Arogya Shri in terms of ensuring that the poor can also take the tertiary care with the support of the government system, but he has also demonstrated. So I would like to ask him, sir, what are the best practices in terms of affordability of medical education? Second, was there any experience you want to share with this august audience in terms of access to the rural healthcare? Medical education is in terms of affordability and bridging the access of these particular medical professionals or the other paramedical professions in focus to the rural areas. Dr. Bhaskar garu.
Good afternoon. See, the affordability care, that was the main theme when I started practicing how to see that it will be affordable to the common man of a cardiac surgery. At that time, they were doing around 65,000-70,000, and then I started doing for a decade from 1996 to 45,000 as a total package. And the three important things which we have been realized in a healthcare system, there are the three stakeholders. One is the human resources, that may be medical and non-medical. The second one is the investors. The most important person is the patient. How we can able to tie forever and continue to improve our volumes, as Vinamani said about volume is the key to bring down any cost. So that is the way that we can able to develop and demonstrated. Patient expects affordable quality care. Doctors wants to stay a long period of time, and so that the patients will continue and they will also provide a good quality care. The investors, whatever they invest, they want to make good amount of money on their investments. I've been proved and showed for all three of them. I'm doing the lowest RPOPs in the listed companies as of now in India. There may be 10 listed companies are there in healthcare. Out of that, we are the lowest and we are making highest profits in it. That's why our stocks are sustaining forever. In a healthcare, we should not talk about all these things, but now the country is like that. The second important thing, doctors never left me. Nearly 250 doctors, whoever's there with me, they are still there with me. Only 2 doctors left. The third one is the investors made a good amount of money when I went for the IPO. So affordability was the talking about at that time when I started in 1990s. Later on, I realized affordability is a relative term. It's not a term which needs to be strengthened or utilized. If you look into that today, hardly less than 1% of the population are non-affordable for anything in this country. That much I can able to assure you. One reason, if you want to do some witness for that, you go evening 5 to 7, all the brandy shops are full. You know who are there? They're all the daily laborers. Not the people, they are rich people, they have already stock in their bar, and other people will have at least monthly stock, 15 days stock. Even in Ahmedabad, every house there is a full. Wherever we go to Ahmedabad, we can have So that's why what I am saying is the relative term. When we have 100 rupees, we can able to get a health care. There is a 10 lakhs, there is a affordable health care. The affordability of that strata is people are expecting. And in fact, I can tell you the other example. In Puttaparthi, we are doing free surgeries. We should have been at least 20 years waiting list. Totally we are doing free. How many people are coming from the entire country? If the people used to come, they would have been increased the number. When I was doing for 45,000 rupees in Mahavir, I should also add about 10 years experience. So it is not the question of non-affordability of the Indian community. It is the best Indian healthcare is the best in the world. I can able to tell you that much. You want to get it in America and the UK, in MRI, you can't get it done less than 10 minutes. The moment when you enter into the hospital. There in last month I went to UK. For hospitals they will come once in 2 days, once in a week for MRIs. Till the time the patient has to wait. It is not available all the hospitals MRI CT. Here with us 2 or 3 MRIs or CT scans available. Every hospital. Even the smallest hospital. So it is not the cost that is important. What these people have been looking into that. We have a 50 rupees shirt, we have a 5,000 rupees shirt. A person who can't afford, he will go with 50 rupees. The same guy, once he makes money, he doesn't want to go to 50 rupees, he will go to the 5,000 only. We have available 50 rupees food, we have available 10,000 rupees food in the... But everybody has their own way of selection. So that is not the important criteria. Even today we are all talking about healthcare. Nearly 30% of the population who are before the admission into the healthcare above poverty line, they fall down to below poverty line. The reason is, it's not that they are all saying they can spend for anything, but they don't want to spend money for healthcare. They think it should be provided free of cost. That is the mindset they have been built in. You know, the healthcare cost is, all of you know, if you want to make it affordable, it is a cup of coffee. It is just a cup of coffee every day. The cup costs about 10 rupees minimum, which is not available also, minimum 15, 20, but 10 rupees you take it. 2 cups each one of us will drink every day. So that 20 rupees will become 365, it is 7,500. If you pay 7,500 to the insurance company, you go to any hospital, 2 lakhs they will give treatment. So where is the question of non-affordability? When the bars are full in the evenings, in the brandy shops are full, cigarettes are full, everything is full. But when we don't want to spend money for the healthcare is concerned. So affordability is concerned, it is not that we don't have the money, but we don't want to spend. There are some people keep postponing it. And we are talking about all the preventive medicine. We are not doing any preventive medicine. Preventive medicine is a wrong term what we are using since morning. Prevention is different from screening. Screening means you are identifying the disease for our benefit, so that the patients will come to our hospitals. Prevention is entirely different. Prevention is on 4 factors. You know why diseases comes? 3 major reasons. One is the most important we are talking about since morning is the diet. The second important thing is communicable diseases, because lack of hygiene, personal, surrounding, in-house hygiene, that's why most of the diseases comes. Then the third one is the brain, because you want to urge money, tension, running around, everything. So these are the 3 important. Then the fourth one is the rich man's disease. Like if you stop all McDonald's, Pizza Hut, 50% of the beds will go waste. So because these are all food items, these are all nutrition. So that's how when we want to really do, there are so many diseases that comes because of diet. All vitamin deficiency creates so many diseases, so many cancers, which is normally can be prevented. So that we need to be able to go into the focus, root cause of all these diseases, really enrich, empower the population. That diet is the most important, hygiene is the most important. Money is not going to give you peace of mind or happiness. The day when we look into all these things, affordability will be there. Coming to the medical college, what we are doing, I was discussing with them. Now, thanks to Ayushman Bharat, the government of India has come with a scheme called Ayushman Bharat. With that, even though we provide free health care, we can make at least $15 million on hospital itself. So we don't need to worry about it. So healthcare can be, if you are talking about before, it's a free, it is not, you don't need to spend money, we can still do it. Even today, the education is not expensive. If you look into that, the entire medical education, 75% of the students, that means we have 92 medical students every year admission. Out of that, 75% of the people, they get the healthcare education less than 1 lakh rupees per year, which undergraduate, LKG student is not able to get that. So we have a misnomer that healthcare is a very expensive. These are all expensive. Yes, there are people who are charging 1 crore, 1.5 crore. But that is for the rich people, that is they are affordable. While charging them, we can able to give for the poor people or the middle class people. So it is only 25% of the medical educated, the out of 25,000 of a lakh of medical students are paying this much money. They are also coming to that school by paying 1 crore because they need that degree. Otherwise, they are not going to be a sustainable human being because they are all rich people's sons and daughters. So that's how medical education is not a expensive thing for a common man, a middle class or lower middle class. Even Hyderabad, in Andhra and Telangana, you know, the fees is 10,000 rupees per year. 50% of the medical students pays 10,000 rupees per year. Where else you will get that much of education?
Right, sir.
So,
On that note, about his broad observations that, affordability is a relative term, and he has quoted many of his experiences in terms of the cost of the medical education, in terms of the access or having funds at the available at the family level and how they are spending it in terms of whether for nutrition or education, that sort of a distribution he was referring to. Now there is another dimension to the medical education which is very important in terms of regulation. The Medical Council of India or National Medical Council. Now we have Dr. Vinky Rughwani who is a Vice President for the Maharashtra Medical Council and is also a very senior pediatrician. So let's try to get his perspectives on the affordability of the medical education vis-a-vis the National Medical Council, because it's a regulatory body. There's some changes, and government and private, there are some caps which have come up very recently also. Dr. Rinko.
Thank you so much, Dr. Ramana. I think I remember those days when I took admission in MBBS, my fees was 1,500 rupees per year. And suddenly our government, the state government, increased it to 3,000 rupees. We did agitation. And it was then, after our Andolan and all, it was reduced to 2,000 rupees. So, very surprising that today we are not doing agitation for even, we did at that time for 1,500 rupees, we are not doing agitation for 15 lakh rupees. And I can say, not even for 1.5 crore rupees. There are colleges where the fees is 1.5 CR if you count the total fees. So my views are slightly different from Dr. Rao's views. I feel like the policies are there, but they need a lot of change. You know, we see that the National Medical Commission has now come with few good initiatives, I can say. Likewise, initially there was a criteria of having 25 acres of land in a city area. Now they have removed that criteria. That is good, because if one spends spends on buying 25 acres of land, we can understand that ultimately that burden will go to the student. who is going to take the admission in the MBBS course. Also, now we see that they have one more change which is proposed, is that now previously there was this thing that you can start medical college and hospital together. Now they say that there should be a hospital which is already running since last 2 years. Now how it helps, I tell you. Now if the hospital is running since last 2 years, it is self-sustained hospital. So that means the hospital expenditure will not be burdened on the student. If the new hospital comes up, that burden of the hospital expenditure will also be on the student fees. So that is another thing. So there are now few changes which are coming, and they are definitely welcome changes, and we in the future we can see that there may be some reduction, or some or other way we can find out some solution. See, there are fee regulating authorities in each state, but there is no regulation on the deemed universities, deemed medical colleges, and we all know that we know that there are 90 lakh total students who are actually giving exams, out of which we know that ultimate selection, there are 16 lakh students who are appearing for the NEET exam for undergraduate courses, out of which 8 lakh are actually qualified, and out of which only 90,000 students, they get admission. So we can understand that what about those majority of the students who went for that particular exam and are not qualified? So we should look to those students also. We should accommodate them, and ultimately that will give a good quality physicians and the doctors to those who can serve in the rural areas. So there are many things. I think the affordability is a big question. Government policies needs to be changed. Of course, the other people like those who are coming to have a supportive mechanism, they also will play a big role in making this system to make more affordable.
Thank you, Dr. Vinky. Now, that's a very important and highlighted point, that the National Medical Council is going to play a very key role in future also from now onwards. There are certain broad thoughts and then policies which have come up. For example, there are now minority medical colleges. There are some particular colleges in terms of hospitals. If you look into the guidelines, the PPP model has come. District hospitals can be utilized for setting up a medical college, what is happening in some of the northern states here. So distribution of the medical institutions as such, if you look into the map of India, 40% of them are in these Karnataka. South India has got a very high density when compared to, except around Delhi, right? The other parts of the country do not have this. So taking these 2 points in terms of the policies of the government, for example, public-private partnership, taking a district hospital of the government and then asking certain good corporate houses or industry houses to come into the medical education is some thoughts. And I want to take these questions from Dr. Rajesh, who is basically a critical care specialist. I also want him to start touching base with the other healthcare providers, particularly those who would be able to contribute to the overall healthcare in the rural areas. So my request to you is that, what are your thoughts on these new ideas which are coming up in terms of PPP vis-a-vis establishing a medical college, district hospital using and coming up with a medical colleges required, particularly in the northern parts of the country. The second is other rural healthcare professionals which are needed so that the rural healthcare improvements can happen in the near future. Dr. Rajesh.
So, I will take your question in reverse order. Is okay? Okay. So, have you ever tried to analyze, tried to find the gap? Why doctors do not go to work in rural area? Whosoever. Why do we have an infrastructure buildings are erected, but we even don't find a lab technician, even other specialty working in rural area. That I take example of ONGC, not exact, but ONGC there are centers where they drill out oil, they keep their employee in middle of the sea for 15 days, and then 15 days they are taken off. Just an example. Why something could not have been planned for the doctors? Because, when you do MBBS, when you do MD, you have certain aspiration and ambition. Everybody cannot be sant. Everybody, and at the end of the day, 90% of us are materialistic. Very few are there that we directly go to the, we have done, we are happy, we don't need anything. So if something could have been done in a way where the need of the doctors and need of peripheral could have been addressed, and that model could have been developed, probably we would have a doctors who were needed in periphery. Now, second thing, do we need qualified cardiologist, cardiac surgeon, or super specialist in periphery? No. We need a doctor who can support our peripheral population for common communicable disease, common trauma, common mishap, and taking care of mother and child. These were not very difficult issue if this model. This means we need to erect a pyramid where at the base, which is very broad, which everybody need, these are the certain needs. We need to create more professional of this. Not necessarily they are MBBS. They could have been a model could have been created for 2 or 3 year of course like that. Lot of people who have done their science degree, lot of qualified nurses could have been trained for this. Lot of other technicians could have been taken care for this basic care. So if that hierarchy would have been created, and the second thing, the referral, because you have PSC, you have CSC, district hospital, and then tertiary center. That would not have been only taken care our burden, right people going to right place for treatment, rather than it would have given our country a right shape how healthcare should have been done. Probably this. Now, this can be still implemented. Now you are working on tele-ICU, video calling. COVID has taught us that thousands of patients you can manage just by video call. In my 3 months of COVID time, every day I had seen more than 200 patients only on video calls, apart from the routine ICU rounds. And that was the condition for all intensivists in the country were doing that. And that we were doing across the country and worldwide, because a lot of people we had across the world. So if that, now when you talk about the video call and video consulting and video services, there are certain rules and regulations. Apart from that, training has to be done, basic training. Every person cannot probably operate that video call. That's where Sir has proposed that you need one nurse, even one nurse who is just trained for basic operating. She just needs simply a vitals to be taken. She only needs to how to a video call to be operated and a system to be erected where that person can be connected next to where. It can be at PSC level, CSC level. That basic problem. And somebody was saying that 80% of your disease or 90% of your disease is taken by your brain. In fact, most of the diseases, 80% diseases are acute diseases, are self-limiting. They just need 3 to 5 days. Unnecessarily, doctor take a claim that we have treated, we don't do that. Most of the things happens of their own, just you need to give assurance to the patient. So that assurance also has to come from somebody who is authority in that. So that is one module which I think that combination of this tele-ICU plus doing a training for basic, connecting the person who is needy and erecting a system at every district or for the population of 10,000 or 20,000, it's a matter of policy how government decide, but if that can be worked. So that will create a hierarchy where you will be burdened with the appropriate patient. So it's not like that you have headache, you directly go to neurologist. No. Nowadays it happens, if you are affording, if you have money, you have headache, you directly pass everybody and you go to neurophysician. A neurophysician sees only brain. You may be having headache due to glaucoma, or maybe arthritis, but he will see head and he will see every fiber of your brain and try to find out why the headache is there. So you are bypassing system, simultaneously you are bypassing the medical rules also. So this is happening. So this is one solution which I have for the how you can connect the peripheral to the a hierarchy system. Now coming to the government plan that you are creating a medical colleges in every district and thing. I am little critical here, and I am sorry if somebody is government policy maker, they feel hurt. So first I am saying sorry, but I am critical here. You are going to create a professional who is neither properly trained, neither properly qualified by appropriate people, because you have dearth and deficit, severe deficit of the teachers to teach them. You are creating building, you are erecting building, but you do not have a doctor to teach you. So you are creating a doctors who will have a degree, probably, and that will create more problem. That's what our worry is. In fact, sir was saying he got graduated when I completed, passed my 12th and passed out MBBS. My father has spent 75,000 rupees total. I have written it. That is include hospital fees, my clothing, books, everything. Done, 75,000, that's it. Nothing more, including fees. My medical college KGMC fees was 200 rupees per year. Okay. So that was the time, that's the difference. That's not the question of that how. Thing is that we have been trained by those people who were stalwart in that time. We could not replicate that. Seriously speaking, our medical education is has not able to pace up what it was 20 years before. And more number of medical colleges and institutes we are creating, but are we creating quality? So when we are going to create more medical institute, colleges, we have to simultaneously ensure that you have enough human resource to teach and train them. If you do not have enough human resources to teach and train them, you will be creating professionals who have degree but will be more hazardous, because medical science is like flying a plane. You cannot create a pilots without appropriate training. They are going to do harm to the human beings. So this is one thought which every policy maker has to think when you are creating thousands of buildings, converting every district hospital to medical is fine. There could have been a different model to do that, to get that. But giving them a degree, many times we say, I'm sorry, that getting MBBS, MD degree is just a license to kill. Once you have got the degree, now you need to make yourself mature enough that you can manage patient also. So what is going to happen, that is our worry, that's not my worry, lots of us are worried about like that, for that. So when government is making that, this is the answer I have to do, sir.
Thank you so much. Anyhow, time will give us, but very important for the nation to consider at this point of time two options. One is that high cost, low volume medical colleges, or low cost and multiple number, if we increase. And I will not undermine your statement about the quality of the doctors who come. When we generally discuss about this, assuming that the numbers are almost ready for the nation, say 5 years, 10 years down the line, but the major challenge is how to retain the medical doctors in the rural areas is one thing. So one of the ideas mooted was to make doctors work mandatory for a couple of years in the rural areas with a bait or a carrot that they would be getting some priority in the post-graduation. This is one option. Some time back when I was also with the government system, when we inquired about the primary health centers, why they are not interested in continuing in the rural areas, at least top 3 answers which I vividly recollect is, they are worried about the quality of life, the education of their children, and their social status and financial status are not getting aligned. These are the three things which have come up, though they are not evidence based, but these are all some of the things about our direct experience in this. So I want this panel to take this, how to retain medical professionals in the rural areas. There are no doubt that there is a maldistribution, urban-rural variation is very high. Even medical institution concentration is improper, disproportionate across the country. So today the focus is on two things: how to create a sustainable rural doctors. One of the suggestions you have mentioned is make it as a bachelor degree of 3 years. I do not know, many of you may be aware, there was one experiment conducted in Chhattisgarh, another in Assam, and a comparison study was made by Public Health Foundation of India between MBBS doctors, Ayush stream of doctors, and these science graduates of 3 years. They are called community officers. So in terms of common diseases, I'm talking about common diseases, right? I'm not talking about complex diseases. In terms of critical thinking, clinical assessment, cognitive things, there was reasonably high acceptance. This is also available in public domain also. So please, is that the solution to replace a fully trained MBBS doctor with a 3-year trained science graduate is one question. Second is how to retain the doctors who are all coming out with our medical institutions to serve the rural areas. Sir, anybody would like to take this question?
You already mentioned about the bond, you know. So there, we know that in every state there is different policy. In few states there is a bond, 1 year bond after MBBS, then 1 year bond after post-graduation. In few states it is 5 years bond after MBBS. Now we have seen the states where even 10 years bond is there. So I think this is impracticable. And it is also a compulsion, you cannot compel. And also you said that the doctors are worried about their quality of life in the state. So instead of bonds, or in addition to the bond, which should be in a very light way, maybe 1 year, not more than that, you can have some incentives to the doctors who are serving in the rural areas. You can have a larger perks for them, and also you can, like after MBBS, if you serve for 2-3 years in the rural area, you will get a post-graduation, admission in the postgraduate of your choice. Now this has been experimented in few states, and it has been successful in doing this. Because of these incentives, many doctors, they go to the rural areas. So there are these ways by means of which we can have the larger number of doctors who can go to the rural areas and they serve. Another thing is that we always say that this point always comes like that the BMS doctors who can't do allopathy practice, they cannot treat the patients or emergencies, and they can only give the medicines only at the time of emergencies. The homeopaths cannot use the allopathy treatment. So I think if we want that the if we want to ensure that the physicians or the treating people should be there in the rural areas, somehow we have to accept this mixopathy. We cannot say like ki wo homeopathy wala, he cannot give medicines. In a small village of 1,000, 2,000 people, we cannot expect an MBBS doctor will go. So these are the few measures I think we can take into account.
Thank you. You know, we have seen Dr. Bhaskar coming out with some out-of-the-box solution. Sir, particularly the recent Government of India statistics say very clearly that the vacancies of the specialists, particularly general medicine, general surgery, pediatrician, obstetrician, and anesthesiologists, in the secondary tier of healthcare institutions is about 80%. So vacancies are 80%. So you have been involved with a lot of postgraduate education, and so I want you to just respond to these two issues, sir. How we will be able to resolve the rural doctors working on a sustainable basis, on a long-term basis in our rural areas is one thing. Second is how to take care of the vacancies in the specialty areas, because if you look into the burden and treatment while we talk about primary health care and the cases being referred to the secondary level health care. There are a lot of data available, particularly acute care medicine. So secondary level care must be available, accessible to the nearby rural areas, no doubt. Do you have any thoughts on that? Do you find certain special experiences or best practices out of your experience? Dr. Bhaskar.
So what happened, if you look into the history of medical, see when previously they used to be all the medical colleges in urban area. Then they want to improvise the peripheral area, the rural areas. That's why the MCA has come forward with a mechanism of saying you should have 25 acres and 500 beds if it is 150 seats. That cannot be bought by the urban areas, it has to go to the rural areas. So that's why they established this. Initially, there was a lot of struggle to get the faculty. Today, faculty is not an issue because last 3-4 years, there is double the postgraduate seats. I am running a medical college in remote area, a place called Raghul, hardly 1,000 population. In that, after I took over, now there is a 600 beds full, all the faculties are available. And I do at least 10 camps, outreach camps by my postgraduates so that the rural health will be well taken care. From there the patients are coming. So staying with the doctors next coming to few years may not be an issue because the number of postgraduates is nearly 40,000-50,000 people. Even some of the super specialties, people are not joining. There will be an issue for the pre-medical, paramedical courses. But all the clinical branches, there is no struggle, are full. And if you take any district headquarters anywhere in India, whether all the super specialties are available, more than required. So doctors is not at all a concern today. And especially anything, if you want to bring down the price, it is not the government is not going to control. It is the competition which brings down the price. Anything you take it. It is the competition which brings down the. So once the more and more colleges, more and more students have been come out of that, then they have to go definitely in the rural areas. There all been today a person who is getting ₹1,00,000 in Hyderabad, if he goes to the periphery, he will make 3 lakhs minimum. So there is an incentive base is there. So that way we can able to retain. So of late, I think the NMC has been changed these land reforms and then the running the hospital. That one way is maybe good for in the urban areas, but still to develop in the rural areas, this is the best methodology. And again now, Modi government is coming with a challenge that every district hospital we want to make it a medical college. If that comes true, and they are going to increase further another 40,000 postgraduate seats, if that is also happens, I think definitely the depth of specialists is not an issue.
Sir. Excellent. That is a very optimistic note, and I am sure down the line, country will be seeing adequate number of doctors. Sir. Now it's a time for the audience. In view of the respect for the time, I will allow one question, and then if there are other questions, I will request all our honorable panelists to be available to the audience. Right, sir, please.
Good afternoon. I think we are missing family medicine, family practitioners. That is the big gap that is being created, and people are going to specialty directly because of that. We don't have family doctors. If we can increase that clan everywhere, even in rural area, it will be a big boon. With health workers and family doctors, we can create good system. This is my view.
That's a good idea, sir. But please remember that there are two views on that. Quick observations. One is that all MBBS doctors are supposed to be a family doctor. If family medicine is considered as a specialization, in terms of their income and other things, it's not much evidences are available. While I do agree that family medicine has to be a specialization, what has the developed nation has seen, but I'm sure that discussion can continue on that. Any quick comments from any of this. One sentence, closing remark from three of you, and then we'll close the session in next 180 seconds. Please.
So
Yes, please.
quickly, just a thought about one. It just struck to me. In the most productive year of your life, that is, you just passed MBBS. That's the biggest hurdle which nobody. And at that time, while you are pursuing for post graduation and something like that, if you are forced to go to periphery and anyway MBBS is 5 or 6 years, that will remain a biggest hurdle. You know, even the monetary bond up to 20 lakh rupees, people are ready to pay rather than going 1 or 2 years to the thing. So probably that will not solve the problem. Policy maker will have to come out. Look, you cannot treat everybody with same stick. Student who are meritorious, who are academics, who wants to pursue their academics, let them do that. There are people who just want to do MBBS, that's like that. There are like, so if you will not create a hierarchy of different level and will try to treat everybody the same, this dissimilarity will persist even if you have thousands. Suppose you create 10,000, 20,000 or 50,000 doctors. But if you do not create what they need, and if you do not ensure or do not address the need of the doctors, and in the most productive time of the doctor, you ask them to 3 years, give 3 years for just being rural and doing nothing, this problem is not going to get over. That's what my thought.
Thank you
Good
so
afternoon,
much.
sir.
My
Why don't you send
close-
the doctors on rotation to the peripheral
I said
areas?
that. I said, sir. I said that. That's
One
why I said
point.
just 15 days you keep them on rotation on that. 15 days let them work, and that will probably work.
And
that
the
I
other
agree.
thing what you have said that I little bit differ from your point of view, that when states they are allowing non-allopathic doctors to practice, and when we put a medical colleges in district headquarters, the training will be definitely better. Instead of going for 3 years course, why not 5 years course in a rural places?
I'm okay with that. I'm not. You said.
Let me take this right. Sir, there are certain efforts. What you mentioned, it is already under implementation to a certain extent, and we will see a wider expansion of that. One of the important things which has come up from the pedagogical educational point of view is that I had an opportunity to be part of that. Even in the school itself, if there is a process which we can identify certain cohort of students who can take certain ideas, you know, some of the parents may not agree with that. So they can choose their profession of choice, and for a noble profession like the medicine, if passion can also be part of that, and I'm sure that if the medical institutions can create a culture of excellence, education can be painful or intense as in the course of many of the medical colleges, but I'm sure that fruits would be very sweet. And the universal health care which we have committed as a nation, there are bright chances, and this discussion has identified several pointers towards that. I want to thank the organizers for giving us this opportunity once again. Thank you, panelists, for your wonderful comments. Thank you.
Thank you all for that insightful discussion. We now request Dr. Vasudev Upadhyaya, the head of the Department of Anesthesia, with over 27 years of experience in educating and teaching the postgraduates, to hand over a token of our gratitude and appreciation to all our panelists. To Dr. Bhaskar Rao, Dr. Rajesh Mishra, Dr. Vinky Rughwani, Dr. G.V. Ramana Rao. Thank you, everyone. We now request the AV to be played.
Healthcare. Right to good health is a basic right of every human born on this planet. With this idea, Sadguru Sri Madhusudan Sai embarked on the mission providing compassionate, quality and free of cost healthcare, starting with the heart by addressing the global burden of congenital heart diseases in children. First dedicated totally free of cost, Sri Sathya Sai Sanjeevani Center for Child Heart Care was established at Nava Raipur, Atalnagar, Chhattisgarh in November 2012. In November 2016, the second Sri Sathya Sai Sanjeevani International Centre for Child Heart Care and Research was inaugurated by the Honourable Prime Minister of India, Mr. Narendra Modi, at Baghola, Palwal District, Haryana. The third hospital, Sri Sathya Sai Sanjeevani Centre for Child Heart Care and Training in Pediatric Cardiac Skills, Kharghar, Navi Mumbai, was established in November 2018. As of June 2022, over 14,750 pediatric cardiac surgeries and more than 5,350 cath interventions have been performed across the 3 heart care centres. More than 170,000 pediatric cardiac outpatients have been attended to, and over 197,000 outreach screenings have also been conducted. The Sanjeevani hospitals have also successfully treated patients from 14 developing countries and conducted 4 international child heart care missions in Nigeria and Fiji. Healthcare Education and Training. Sri Sathya Sai Sanjeevani Institute of Nursing and Allied Healthcare Sciences at Nava Raipur and Sri Indulal Shah Centre for Training and Education conducts numerous academic training and skill development programs for doctors, nurses and allied healthcare providers to develop their skills and experience. Research. Sri Sathya Sai Sanjeevani Research Centre for Congenital Heart Diseases at Palwal, Haryana pursues advanced human genomic research in congenital heart diseases and aims at unravelling the possible causes of this disease. The centre also houses India's first biobank for congenital heart research. With the growing need for a multidisciplinary facility, the Sri Sathya Sai Sarla Memorial Hospital has been established at Muddenahalli, Karnataka, high-dependency inpatient facility with specially equipped pediatric and neonatal ICU facilities, providing services completely free of cost. The hospital was formally dedicated to the service of the nation by the Honourable Chief Minister of Karnataka, Mr. Basavaraj Bommai, on August 27, 2021. Envisioning the expansion of services by providing free medical education to rural students with the sole aim of creating service-minded medical professionals who will serve in rural geographies, the first of its kind pre-medical college will start functioning from June 2023. For this purpose, Sri Sathya Sai Rajeshwari Memorial Academic Block and a 400-bedded multi-speciality hospital is coming up adjoining the Sri Sathya Sai Sarla Memorial Hospital. While the Sri Sathya Sai Sarla Memorial Hospital will serve as the clinical teaching and training wing of the medical college, the Sri Sathya Sai Rajeshwari Memorial Block will serve as the preclinical and paraclinical wing of medical education. On April 1, 2022, Honourable Union Minister of Home Affairs of the Government of India, Mr. Amit Shah, laid the foundation stone for this completely free of cost new 400-bedded multi-speciality hospital in the presence of Sadguru Sri Madhusudan Sai. Apart from the pediatric cardiac hospitals, the healthcare mission is all set to expand and establish 10 mother and child hospitals across the country in rural areas to cater to the pressing needs of maternal and infant healthcare in India. 2 hospitals at Nava Raipur and Yavatmal are already operational. On the international habitats, Suva in Fiji, Batticaloa in Sri Lanka, Ebe and Imo in Nigeria, and Clarksdale in USA are also providing free quality healthcare to children and the needy absolutely free of cost. On April 27, 2022, South Pacific's first super specialty pediatric cardiac hospital, Sri Sathya Sai Sanjeevani Children's Heart Hospital, was inaugurated at Suva, Fiji, by the Honourable Prime Minister of Fiji, Mr. Josiah Vorenke Bainimarama, in the presence of Sadguru Sri Madhusudan Sai. From April 30th, 2022 to May 8th, 2022, a team of 21 medical professionals, including a few local medical professionals in Fiji, successfully completed life-saving procedures by performing pediatric heart defect corrections on 30 children of Fiji in just 9 days. Restoring health with compassion and without commercialization is the Indian way, and hence shall we continue to serve every child, every mother, and every human with love.
We are awaiting Sadhguru's arrival in a few minutes. We request everyone to kindly remain seated. Yes. Good afternoon, everyone, and welcome back to this afternoon session. In fact, the most awaited session of today. Gratitude to Sadguru for once again joining us all. Before we begin the question answer session, we will first have an audio visual on our upcoming medical college and how it will be a beacon of hope and the impact it will have on the aspiring new medical professionals in rural areas. Can we have the video, please?
In my village, there is no medical facilities. Nearest hospital is 50 kilometers away from my village.
I am studying in 10th standard and I want to become a doctor. My parents being farmers, they cannot afford medical education as it is very expensive.
The University for Human Excellence has taken the next big step by envisioning to expand its services by providing free medical education to the rural students with the sole aim of creating service-minded medical professionals who will serve in rural geographies. In this direction, a free medical college will be established soon in Muddenahalli by the university.
This institution is something which is an eye-opener to many people. In India, 1.5 million students write medical entrance exams. How 80,000 people get enrolled. I'm going to go into medical field. I did realize that it's going to be very, very expensive and it's going to be time consuming. But then when I came to this institution, I did realize that they are opening a medical college for free of cost.
I have known friends who are very passionate about medical education. They were even good in academics and fared quite well. But given the high cost of medical education, they couldn't afford it and had to change their field of education. I am looking forward to continue my education in this medical college.
I was born in Mandya, a rural district in Karnataka state, mostly comprising of farmers. I have seen hundreds of families struggle to access even basic healthcare facilities. I feel it's my duty to serve the society by dedicating my life towards strengthening rural healthcare in the country. Thanks to Rajeshwari Academic Block for starting a free medical college for rural children like me.
I think the context has been set and the agenda very, very clear before all of us. Without further ado, I request Mr. Rambabu, founder and managing director of Pulse Pharma, to kindly take over the question answer session.
Pranam Sadguru. I'm really humbled and honored to have this opportunity today to sit in front of you and ask few questions to enlighten myself and my fellow audience. I really thank you, Sadhguruji. So first question I want to ask you is, this is what we face in our corporate world, daily life. So we, as CEOs or business leaders and some senior management professionals, so we always battle for time with a lot of priorities and a lot of the complex world. A lot of changes are happening in the world today. So we always find it difficult to balance between our work life, family life, and personal life. We hardly find time to concentrate on spirituality and look inward. So could you please help us how we manage our priorities and how we concentrate on our business priorities and still be able to manage, because otherwise we are almost at the fag end of our life. If we can't do it now, we can never do it. So could you please guide us on that?
I think I should answer this question in your own language. You are a pharmacy man, and every pharmaceutical product comes with certain terms and conditions. There is a dosage, there is a timing, and when it's taken at the right time, at the right dosage, it works. If it is taken at the wrong timing and the wrong dosage, instead of helping, it harms. I think in our life also, everything has to be given its due place, due attention, not more and not less. While I can fully understand that as business people, priorities of running a business, especially when so many people are dependent on you for their existence, their livelihoods, it's a pressure of a great kind. It's not easy. And so some sacrifices are made. But I always ask, at the end of it, our scripture is so clear in India, what is the purpose of why we are born and why we do what we do? It's very clear. It all should lead to ultimately one's emancipation. If you have done everything, you became the richest and have the biggest businesses, yet at the end you have not found your true self, the truth within, then the life is considered a waste. Yes, I'm very nice. Shankaracharya, Adi Shankaracharya will call you as somebody who has committed suicide by wasting a life which could have otherwise been used for attaining a higher goal. So that clear is our scripture. At the same time, see, the business class or the people who are quite busy with these kind of enterprises, they also have a great role to play. What you can do is that think of your business as something that leads you to that idea of moksha.
Okay.
Instead of segregating as this is my business and worldly life, and this is my spiritual and the higher life, instead of segregating them, can you find a way to think that they actually are not different from each other? Your work becomes your worship. Your duty is God. What I mean by that is, when you work, you don't work for the sake of gaining some personal recognition or for your selfish sake. Your businesses, your work, your life becomes an extension of love and compassion that you otherwise are developing within yourself. So your work is not different from your worship.
I think
if you can, as business communities, if we can think that what businesses we do are ethical, are safe for the environment, are for the sake of improving the lives of people, and we consider that as our way of offering our service to whichever God we worship, I think the same act of daily life becomes worship. Having said that, don't take it too lightly as well. Then you find escapes routes, that no, I was so busy working that I have no time to see God or not to think of God. I think that also should not be the extreme. You yourself are your own judge as to whether you're being honest with yourself. So when you really feel this work is to be done for the sake of greater good of the world, that work itself becomes spiritual. And this is our, Janaka is the model for this. Our scriptures talk about King Janaka, who was spiritual within, but externally he was always working for the welfare of the society as a king. In fact, his guru says, when Janaka has a self-realization, and he says, I want to quit all this, and I want to only follow the path of God. And his guru Ashtavakra says, Janaka, you cannot, because you are meant to do what you have born to do. You are a king and you are supposed to run the kingdom. But the attitude should change. Earlier, you wanted to be a king and you wanted the kingdom. Now the kingdom wants you. Therefore, work for the kingdom. So this is the idea. You wanted to run the business for your growth. Now run the business for the betterment of the society. Yes. The change of attitude will change everything for you. Nevertheless, find some time, make it, as I said, the dosage should be correct. You must find some time every day. And I don't tell you to do 1 hour, 1.5 hours meditations and balancing your life and work. But I call it 1 minute meditation. It's very effective. After every 1 hour, take 1 minute off. And just calm yourself down. Just think through what you're doing, why you are doing. Are you on track? Are you deviating? And this 1 minute meditation can happen anywhere. You're walking up to your washroom, between 2 meetings, there is a break. While walking, you think of all those things that you can think of in a nice manner. In the sense, why are you doing what you're doing? Is it selfish or selfless? Is there a greater idea for which you are working? No, that is your meditation for the day. And all 1 minutes added together will be a good enough meditation for that day. So that way you can balance your spiritual life and other life. Second thing is, please share your vision, share your ideas with your family, so they are on board. Many times we ignore them, we think they don't need to know all this, but then they feel very left out. And many families break because the person has done very well for himself and the society, but didn't do much for his family. So you must take them all along with you, and little give and take is life. Sometimes you have to slow down your pace of business to help your family evolve. Sometimes you have to sacrifice the family time for the sake of business. At the end of it, your intention is important. If your intention is pure and selfless, you will find a way to balance everything.
Thank you, Sadhguruji. So I think this is what I've been trying to convince my family, and but since they don't align with my thought process, so they feel that we have done enough. So now this is time to actually spend time with the family and take care of your social, because I'm very very poor in socializing, so I hardly attend social gatherings. So you say, how long you keep working like this, and where is the end for this? So what are you working for? I said, I'm not working for myself. I'm working for that, that gives me the satisfaction, because exactly like what you said, Swamiji. Now I have crossed that stage where I work for money or I work for success. I see a sense of purpose in what I'm doing. So I see the thousands of people connecting with that purpose. So that gives me the real joy. So
sometimes share this, take your family along with you and let them see the benefit of what you're doing.
Okay.
I think they will join you on your side instead of dragging you to the other side.
Yes.
You have to do that sometimes.
Yes, thank you, Swamiji. So next question, Swamiji. So what I have noticed is, in our corporate world, we have a lot of hierarchy, lot of systems, lot of KRAs and KPIs, so many metrics that we use for measuring the people performance, and we do a lot of reviews. In spite of that, we feel that the people do not give their best at workplace. Whereas I have seen in our ashram, this is second time, and I have also seen even in some other spiritual organizations, where there is a very less hierarchy here. The people are self-driven, self-motivated, so they just work in a very cohesive manner and they make things happen. So why is that? And then that's how we are able to scale our operations to any level. Whereas in the business organization, we always find it difficult to scale our operations, because somewhere the people don't align with our thought process, and we need to invest more time in reviewing and monitoring their performance. So that is something which I actually hate doing. Actually, I somehow don't believe too much in Excel sheets. I don't believe in too much of structured processes. But is it good to have structured processes? But my next generation people, they say that your business, you are not very successful because you are not believing in the process. So you have been always informal with the people, and people have taken you for granted. But that is something which I always, it bothers me. Which one is right? So whether I should become very structured in approach in the business, or I should be, engaging the people into the purpose and then leave them on their own.
I keep telling our people this story about Tom and Jerry. You might have seen the cartoon series Tom and Jerry. All the time this Tom is chasing the Jerry, but never gets to catch hold of it. And the reason for it is because while Tom is running for his food, Jerry is running for his life. Therefore, he can never catch him. So you run your business as your life, whereas your employees work there for a living. And that's the difference why they don't really get motivated as you. So unless that is also becomes their life's only purpose, only then they will engage. But most of the people are working for a livelihood, and if not this company, they'll move to the next one for a better salary, better prospects. So you can never get there 100%. In charitable organizations, this passion for doing good. See, the purpose is the topmost. You have purpose, you have people, and you have processes. Generally, most of the corporate organizations are stuck with people and processes. People don't follow processes, they pull them up. And the purpose is not shared. There is no shared vision for everyone. That's why I tell this another story, just to explain to you the background of what we are doing. It seems John F. Kennedy went to the space station, NASA, when they were launching the man on the moon. And when he met a janitor at the gate or the lift, he asked the janitor, "What are you doing here?" And that person, so to say, grade D or whatever level worker, he told, "I am helping America put a man on the moon." Look at his sense of purpose and shared vision. Same thing I tell our people from our hospital, from the watchman till the chairman, everybody should speak the same language. The watchman should also say, "I am helping save a child." Chairman also should say, "I'm helping save a child." Watchman by manning the gate, chairman by manning the organization. See, unless we share the vision with everyone and they feel a part of it, we cannot make a successful venture. We can drag it for as long as we are there with processes and all these things. But purpose is the most important thing, and if we share that purpose with everyone, that means you have to spend a lot of time with your employees. And most of the time in the race for productivity, the management finds very little time to work with the last level of employees. There are great examples, and I am always appreciative of Tatas, and I've studied how Tatas build their organization. They are in touch with the last person. Their ears are on the ground, even of the top management. So that way the vision is shared. They see the vision walking and talking and breathing and speaking through the topmost man, and that rubs on to them. But hierarchies don't work. That's why our organization structure is very flat, very lean. In fact, if you put it that way, in an organizational way, suppose I am managing an organization here, I am available to the last person also. We have a program, Satsang in a Darshan, where we walk around. And when you walk around, even the sweeper's son can get up and stop me and ask me any question. And he has as much right on my time as everybody else. So we have to make that time for our last person, what you call the shop floor employee. Then they will share the vision. And when everybody speaks the same language, it is possible. But as I said, initially, Maslow's hierarchy, people come for food and security and all that stuff, and purpose comes much later in life. But if we look after them well, we share our vision, we spend time with them, we engage with them, sooner or later they will pick up this purpose. And employee retention is such an important thing, because it's otherwise the wastage of your all resources, time.
Correct, absolutely.
So if an employee comes with you and willing to stay all his life with you, out of his own joy, you are a great leader, I would say. He doesn't want to leave, even for better money, better opportunities, doesn't want to leave you, then you have done your job as a great leader. So in service organization, that is what it said. The model is society, samstha, samaja, sarkara. Samsthas have this passion. In NGOs, this passion is there to do good, which you will not find in government and even in corporate side when people are working for just a living. So that is why this collaboration is so important. These are the people who go to the last mile to do the work. And if they are supported with the other two sections, I think anything can be achieved. But having said that, as corporates, you must spend a lot of time with your people. Absolutely. And share the vision, and not get so busy achieving things that you build very flimsy foundations on which the institution won't stand for too long. Sometimes an organic growth is good.
Thank you, Sadhguruji, because this is what strengthens my idea. This is what exactly I believe. In fact, whoever walks into my room, I spend more time in orienting them and selling the vision. And I discuss my ideas with every functional head. Even if it is not directly related to him, I discuss just to make him engage with the purpose. So thank you very much, Sadhguruji. And then the third thing what I have noticed here, that whatever the project that you have taken, it gets finished very fast. And your wish becomes a command for your team. And whereas we find it really difficult, we always overrun with our schedules and times. So that's another thing I wanted to really know. What is the secret here that, a lot of projects, not one, I think people have been sharing. So Sadhguruji comes and for the foundation stone, and he says, he fixes the muhurt, and at that day, the building is ready. So, that calls for, again, a lot of commitment of the team here.
Yeah, that's true. Half of the answer is in the previous question. They are driven by a sense of purpose. They find fulfillment, so they are willing to go that extra mile to do anything to make the vision happen. That is one part of it. The second part is that I'm always very goal-oriented. And most of this, you may think a spiritual organization is like quite loose in its process and things like that. But we are also a social service organization largely. And that's why we have to have a very tight timelines, efficiency. So somebody asked me, in fact, they were from Tata's again, when I met, he asked me, how is it that you finish everything on time? I told them, see, I don't give them the start date of the project. I only give them the end date of the project. I tell start whenever you want, that's your convenience, but end date is fixed and you can't negotiate with me on that. And that makes everybody become very serious. So the earlier they start, the better it is for them. And as I said, they're driven by a sense of purpose. They're willing to work quite hard. And we are not paymasters, we can't be. We just pay average or whatever is needed according to the skills. Many people, in fact, in this hospital, many people work voluntarily. Right. And that's a huge savings for the institution, which can be used for something better. But more importantly, as I said, people are driven by a certain purpose. And one day one person was sitting and I said, I think I need to give you some more work. He said, Swami, I'm already working 24/7 here. I said, that's the minimum you must work for in our organization. So we don't work 9 to 5. We work 24/7 throughout the year. There is no day, night. And everybody works with joy. Nobody comes and complains to me how much work you give us. So you imagine if your employees were working 24/7, naturally you will be somewhere else.
Yes.
So how do we finish projects faster? Everybody works harder, 24/7, out of joy, no pressure.
No pressure.
Out of joy. And they want to do it because I have told them they are so driven by purpose. And when we started hospitals, we built hospitals like Srinivasji's here. 9, 10, 12 months is the turnaround times. We begin the operations of the hospital from the scratch. So I told him, see, if it was your child, would you wait for another day? Would you not do it as fast as possible? And so everybody gets motivated. I must just to add a little bit, in the evening we're leaving to Sri Lanka. We are opening another pediatric cardiac care hospital. It's a super specialty, but one of the specialties, pediatric cardiac care. This evening we are leaving. And through the COVID times, through the Sri Lankan crisis, through all the import-export restrictions and licensing, and you name it in Sri Lanka, I thought India is the biggest red tape is in India, but Sri Lanka has a much bigger red tape. And that too in these times, they have the audacity to not even give permissions and licenses to a company or to an organization which is coming and doing it free for their people. But still we struggle through it and people are on ground, they're still working on it. Our medical equipments are stuck at the port, yet they are all fighting their way to make sure that it happens. There are floods in the central Sri Lanka, no fuel. Yet we had decided a date. August 9th is the opening inauguration of the hospital and everybody is working towards it. Idea is that this is what purpose can achieve. If we all feel the same purpose and vision, there is no limit to human potential. Infinite is the potential. So that is what I always tell, make your people be driven by purpose. Yes, because other things won't work.
Sadguru. So Sadguru, it's heartening to know the kind of work that we are doing here. So in the areas of holistic health, holistic education, health and nutrition, the kind of world-class facilities that we are building, the scale at which we are doing this. Now, sometimes I wonder, when we are doing such a great work, why not we look at its sustainability and expand these benefits to some more people? Maybe we are now targeting the people who cannot afford these services, but can we also think of those lower middle class or middle class people to have a better education and better healthcare facilities with some fee, so that they will be happy to pay this? I'm sure this question was asked many times to you and you have refused to accept that idea because you have a firm belief that this is the way to work, and I would like to once again listen to you. I
think every organization has certain core values that they should not compromise. And because of that, the organization grows. The moment you start compromising, there is no end to it. So our organization's core values are very clear. Healthcare, education, nutrition is to be free. And when disease does not differentiate between poor and rich, for case in hand is COVID, why should treatment or any other health facility differentiate? Education is common basic right, so we will not negotiate on that. Rich person's child also is free to get educated here. A lot of people, even people from abroad, come and study here. They have better facilities because they like something here which they don't get anywhere else, whatever the value system and things like that. So it's not just about being free, it's also about being the culture and the value system that we bring for which people come here. And all those who ask me whether this is sustainable, this is scalable, I think just have a cursory look at last 10 years of work. And not 1 rupee has been charged to anybody. And we have 4 super specialty hospitals. And pediatric cardiac care hospitals are the costliest. Most of the corporate hospitals don't have that section because poor people's disease, no insurance cover pediatric cardiac care, and no experts in the country. So we have picked up a challenging task and we have done so well. And we have opened in Fiji one and now we are opening in Sri Lanka another. So I don't think being free, of course, coming from the corporate side, it almost sounds like what sorcery is this? How do you run free institutions, that too high-end institutions, not some primary healthcare center, OPD section or something. But this is the proof of the work. I always tell, the one who does anything with pure intention, with selfless intention, as they say, the universe will conspire to help such a person. And this is our experience. If in 10 years it has not failed us, And we are running, and we have grown from a school to a university. We have grown from a simple hospital to super specialty tertiary care hospitals. And nutrition program, we started with 50 people, takes care of 5 lakh plus children across 17 states and 3 union territories. People have come. People have come and joined us because they believe that this idea is so unique. This core idea that it should be free and available to all is so unique. The moment we put this 80-20 model over there, which is what the suggestion from many people are, many people even before contributing, they ask, we don't know whether this contribution will even help you because you will not sustain tomorrow. We said, don't worry about tomorrow. You do what is needed to be done today. Tomorrow will be looked after. And it has been looked after. I'm not saying it is easy. I'm not saying it is simple. It takes effort. It takes convincing. It takes talking to people. It takes invoking the goodness in all. But I only tell them one thing. We consider everybody as our own. Now, how do I charge our own? Suppose your mother is sick. Are you going to tell, Amma, can I withdraw something from your pension account to take care of your treatment when I can look after it? So for me, all are mine, all are ours. Vasudhaiva Kutumbakam is in action here. It's not just a talk. And we have seen it prove itself. Through struggles and strikes, we have managed. And we have managed to run it free. Never reduced the services, the quality of services, nor shut down any of our operations. But we have been continuously growing. And if you look at the exponential, I think most of corporate people should be jealous of us. The way we have opened and run the institutions purely based on the power of goodness. And I firmly believe where there is love, there is goodness, the whole universe will come and support them. And this is the experience of our institution. This is our core value, which I am not willing to compromise. How do we scale it up? The way we have scaled, we have talked to more people. More people have joined this mission. And just think of it. None of you were here maybe a month ago. Some of you were there a few weeks ago. I met you only a couple of months back. But when you look at something like this, what happens within you? You ask yourself, don't you feel that I must do something about it? I can't just sit and watch this happening. That thing creates next mission and the next institution. That is how it grows. So far we have not been proven wrong. We have stuck to our idea of being free. And I always say it is not a new idea. India was always about free education, free healthcare. Our Vaidyas never charged anybody. That's why Vaidyo Narayana Hari. Our teachers never charged anybody. That's why Acharya Devo Bhava. Food was free. Annakshetras, temples, homes, anywhere you can go and get food. There was never a concept of hotel in India. Restaurants where you have to buy food. This is all Western idea. India, anybody could walk into your house and say, Amma, I'm hungry, please serve me something. Whatever is there will be served. Even today in Chhattisgarh, where we belong, we have a hospital. The tribals have more buddhi than the rich people. In the middle of the forest, when they go to collect some forest produce for their living, they carry food from their home because they'll return only in the evening. And when they sit down to eat the food, they shout out, is there anybody hungry around? I have some food. I would like to share. Even a tribal person knows that food should be shared and not sold. He doesn't say, if anybody is hungry around, I can sell half the food for such money. He just says, come and share it with me. Today also in villages, there is practice where people wait for some guests to come, feed them, and then only they have their meal. This is the India that we lived in. That is why we were so prosperous. Whatever Sone ke chidiya and all that. Living like this, we were more prosperous. By not living like this, we thought we'll become prosperous, but that has not happened. We have become one of the poorer countries, still developing country after 75 years of independence. So I have completely, firmly believe, and I believe human goodness has infinite potential, and wherever good happens, God is there. Literally, G-O-O-D, good, G-O-D, God. I say every good has God in it, and God is the owner of this whole universe. What can you tell him? So far, it has going well, and we will stick to our guns, come what may.
Thank you so much. What is the vision for this medical institution that we are building now? How big we want to, how we want to scale up this and how many places we want to go?
See, the medical institution was not initially a part of our vision. We were running hospitals and we were happy to provide healthcare as much as possible, and we were okay with it. After that, what happened was not really concerning us. We took care of the patient then. But we were running educational institutions where children join at 6th class, they live in a residential Gurukula system, and then they grow all the way to become a part of the university. So higher education also we did not have 4 years ago. But we added because we realized so many of these rural children will not continue their education if it is not provided free. fact, we opened some institutions because some girl came and told, Swamiji, please open an institution, otherwise my father will not let me study further because he won't pay. We have 4 children, his salary is 4,000 rupees, he is not going to pay for my education. But I want to study. So this is how higher education came into picture. The next thing, what medical education, how it came into picture is because when we were opening so many hospitals, we realized there is dearth of both combination of competency and compassion. Now, that kind of healthcare professionals are missing in the society. Some people are very good, but they may not be extremely competent. Some people are very competent, but they're in high demand. They are not available to do rural work. So this was the gap that we found in the medical education. And many of our students, we started sponsoring their medical education in various institutions because they wanted to become doctors and serve in rural areas. So after having thought through the whole thing, now that this year we are opening almost 10 mother and child centers from all the way from Rishikesh in Uttarakhand down to Karnataka, everywhere in West, East and Central India. We need doctors, we need paramedics, nurses, and we want them to be inspired people, who don't run behind their personal kind of career growth and things like that, but more out of compassion for others. At the same time, we are not saying we'll deny them any personal growth. That also will be a part of an institution. It's a professional institution. So medical education came into picture because many of our children wanted to become doctors, but coming from vernacular backgrounds, they struggle to get into premier institutions or get a free seat. It takes time. The NEET does not. It is not a level game. NEET is vernacular people find it difficult to read English and write exams in it. So we thought we must train them, but we have created so much goodness in them from the 6th class onwards that they have passion to serve. And we thought if we continue to give them the opportunity to be with us, probably they'll become our warriors. They will go to all the rural areas and do the work. So that furthers the cause of this mission. So it is like a self-perpetuating model. You get these children trained into medical education, they become part of our medical system, healthcare system, and it furthers itself. So from that point it has come. Now where it is going to go from here, as I said, we might be the only unique institution. Apart from being free, we also have nursing and paramedical courses all under one roof to ensure that it's a complete system is taken care of. Second, I believe this becomes a success in 5 to 10 years. If we have good participation from people, from the governments, from all the sections of the society, probably I would like to open 5 such colleges across 5 corners of the country, especially Northeast and desert areas of the West, because we have patients coming from there, from everywhere. But that is the vision in 25 years. The 100th year of India's independence should see at least 5 of our medical colleges across the country, and all free. Nothing being charged. That is the vision we have.
Thank you, Sadhguru. Sadhguru, I have seen most of the spiritual institutions, they focus in enlightening the people through discourses, and and they try to achieve peace through meditation and all that. That is what mostly the spiritual organizations focus on. Contrary to that, we are doing a lot of seva. So what is the idea behind choosing to do a lot of service to the mankind, and service in the physical form, not just only giving a good advice to better their life?
It is our firm conviction that all spirituality must express itself as service. Spirituality bereft of service is not spirituality at all to me. And service bereft of spirituality is not service at all. So they are like two sides of the same coin. Now you say you are spiritual, you feel the oneness of everything, you have love and compassion for all. How can you see somebody hungry? How can you see somebody struggling, sick? How can you see somebody without education or unemployment? What kind of spirituality is that? Similarly, when we do service, many NGOs believe in service, but they don't believe in God, or they're atheistic or whatever. But their service is also not complete because they're only bringing the physical relief, mental relief to the people who are being served. They're not bringing the spiritual component, which is far more important when you do service. So we found ourselves in this sweet spot where we are a spiritual service organization, and till recently we used to call ourselves a spiritual organization which was doing service, but of late we have redefined ourselves as a service organization which is founded on spiritual values. So we are largely a service organization, and I think this is the model, this is how it should be, that every spiritualist must be service oriented, because spirituality must practically demonstrate, express itself as a help to somebody in need, which Gandhiji said, there are so many hungry people in the world that God cannot but come to them as bread. So for the hungry, bread is God. I talk to him about Advaita Vedanta, he's not going to understand anything. He's suffering there with hunger. I put a plate of hot meal, he eats it, then I tell this is sent by God. Trust God. I have better case. So what is needed in the country, what is needed in the society is what we need to do. Empty words will not fill anybody's stomach. So my whole concept of spirituality that we must make it service oriented, and all service should be born out of the spiritual love, not for self-aggrandizement or some kind of you want to win an award or a reward or a medal somewhere. And many people, I often joke, the amount of service they do is not even worth the garland that we have to put on their neck. That's costlier than their service. So I don't want such service. Silently we do service. Many people tell us you are not known despite you do. I think we are the world's largest pediatric cardiac care hospitals, which is free also. And still there is no news about us anywhere. Very little is known. I said because we believe in doing, not talking too much. We believe in work, not mentioning about it too much, but it spreads like fragrance. Now, whom we need, they come to us. The patients come to us. We don't advertise, they come to us. Right kind of doctors come to us. Right support comes to us at the right time. So this is our model. This is how both should go hand in hand. But we are finally saying that service should be our front end and spirituality should be the back engine which pushes service.
Thank you, Sadhguru. Maybe we'll take some questions from the audience, Sadhguru, with your permission. Yes. So, anybody from audience? Yeah.
Sadhguru Pranam. I'm a public health professional. For us, health is defined as not only absence of disease, but presence of physical, mental, and social well-being. In 1998, World Health Organization has met. They wanted to add the spiritual health as the fourth dimension. It is documented, sir. Somehow it could not take to the right place. Now we have only 3 dimensions. My question to you is, we as doctors, we are obsessed about this evidence-based approach. So my request to you is that can you just throw light on for what I call who looks at the materialistic things. We believe in double-blind randomized control trial. How I can convince a person who talks about this evidence? Second is that, is there a scope that with people like you and others can include spiritual health into the overall, because you have referred to the word well-being in the foreknown. Thank you.
A much disputed idea, spirituality, the most misunderstood concept at this point in time in the world, because we mix up spirituality with religion. And that's where the confusion is. Most of the institutions want to remain secular. They don't want to talk about something that will create conflicts. So the first reason why spirituality as a term is rejected, because it's mostly compared with religion. So if you're religious, you're spiritual. It's not true. Religion is a set of doctrines or rules or regulations which helps you to follow a certain philosophy or an idea. It helps people to keep themselves together and follow a certain idea. But spirituality is the concept of the divine existence of all beings. And what do I mean by divine existence? Divinity does not have a name, form, a place, or an address. It is that consciousness which drives everything in this universe. All of us who are able to listen to me or talk to me, or you're able to sit and experience anything, because we have this force within us which drives us. Medical professionals will say, no, that is just a life force. As long as your heart is beating and brain is working and kidneys are functioning, you are alive. Moment it all stops, you are dead. Now, what makes it all stop is my question. You will say disease makes it stop. But our spirituality goes a little beyond that. It says, yes, disease is the reason, the excuse. But the real reason for it is something else, prana we call it. And that which drives all this thing is consciousness. That consciousness is God, is what spirituality would say. Religion would say, no, God is that who is sitting in the heaven. And if you do something wrong, He is going to punish you sooner or later. If you do something right, He is going to post you at the higher grade 5-star heaven facility. That is all they tell. That is wrong. I am talking spirituality as a connect with oneself, where one feels that beyond body and mind, their existence continues. We experience that at all times, but we do not acknowledge it. That is all it is. Now you call it as, now how do I make it evidence-based at this point in time? How do I put it together for people? See, I am not talking about the whole world. Let us take only India as an example. Now in India, everybody subscribes to some faith or the other. All patients, even your patients would come. They trust that God whom they believe more than you and your medical expertise, and especially in critical times. And you cannot deny them that right to subscribe to an idea, a thought, a philosophy or faith which makes them feel comfortable. And that is why it has to be included as whatever faith or philosophy you follow, which helps you connect to your higher self, which helps you connect to your self within, makes you feel comfortable, peaceful. That is spirituality to you. I don't want to define it under a religious principle. So if you define spirituality correctly, probably it will get accepted better. And how to evidence God, existence of God, is very difficult to say, because the scriptures describe yato vacho nivartante aprapya manasasa, that which cannot be empirically found or that cannot be measured through our senses or any other metrics is God. By definition, it is not measurable. So there is no way you can put in evidence. But then I must talk to you doctors, and you also use this. You heard about placebo effect, right? Now, is there any medicine in that? No, but still people get cured. And is there any evidence? But still placebo effect is a known phenomenon, is a well-known phenomenon. When you have nothing to do, give sugar water to the patient and say, this is a good medicine, a new medicine, it will be all right. I hope pharmaceutical companies are not doing that. But how does the patient get cured with a placebo? Same thing is the idea of God and faith. It is by definition not measurable, not quantifiable. So attempts will not work. But it is a concept that helps people calm down, helps people believe hope, faith, and that helps them to reduce their anxieties. See, you as a doctor, you want to operate on somebody's blood pressure is somewhere. You can't operate. But just by giving this idea of faith and whatever, to pray to whichever God you want, however you feel comfortable, it brings down their anxiety. And that is the contribution of spirituality. So if spirituality can simply be defined as any idea or philosophy which that person subscribes to, he should be encouraged to continue in that as long as that helps the person become better, mentally, physically, socially, emotionally. And we all depend on faith. We all depend on hope. Whether the biggest scientific brain also cannot deny that faith exists. And whatever you believe in, that is your spirituality. So that is all I want to say about spirituality. Don't mix it with religion and confuse it. But allow patients to follow whatever they want. Even in our hospitals, it's a Muslim patient, you talk to him in his terms. He believes in Allah. You tell him, pray to Allah, you'll be fine. He goes to a corner, prays to Allah, comes back better. So that works. And that works for every person with any amount of faith. Forget about God. Even if you have a faith in a friend whom you trust a lot, if the friend comes and says, don't worry, you'll be fine. You know he's not a medical expert. He knows nothing about what's happening to you. But just that positive word, that becomes a mantra. That healing power is very, very strong. That's why I tell doctors, tell the truth, but tell in a way that the patient does not get depressed then and there. Tell in a nice way. Tell in a proper way. And that also is spirituality. Speaking with love is spirituality. So at the fundamental level, this concept of a higher power that governs everything and it is in charge of everything, and faith in that is spirituality. And everybody has fundamental right to believe in whatever power. Somebody believes in a tree, let it be so. If it helps that person, how does it matter to us? So everybody should be allowed that. And if we define it correctly, I think it can be incorporated into the overall medical definition of health.
Anybody else? Any other question? So we are, I think, well before time.
Well before. Then I have to ask a question. No chance is mine. So you definitely went through a lot of discussions. I heard some of them on the YouTube. I did not have, I had other engagement today, but I was listening to that. I heard about Professor Dr. Velumani's 1.0, 2.0, and I look forward to 2.0 very, very keenly. And I want our institutions to be a part of that 2.0. That is the first takeaway from this conference. And everybody talked about the rural healthcare, the importance of it, the diagnostic services, doorstep diagnostics, use of artificial intelligence technology. That is the way forward. There is no doubt about it. But before we all return to our places, if we can put in a little thought and say, this is what I can do as a part of this idea of taking healthcare to rural doorsteps. And I'm not saying if we work with one institution or two, we all work together. I was telling on the way we were talking, Dr. Srinivas was telling, Now our presence is there in almost every part of the country with local champions. You know, in Odisha, you need a Odia speaking healthcare professional. You can't send somebody from Karnataka and say, you please handle that center. It doesn't work. In Rishikesh, some, in Chhattisgarh, some, in Jharkhand, you know, you won't even understand the language that they speak, those tribals. So you need somebody from that community who should be a part of it. And fortunately, when we thought this is the 10th year of our medical healthcare mission, and 10th year we must establish 10 centers is what we had thought in India about mother and child care, because we found that, you know, every year we are finding more children coming with congenital diseases. We can't take care of them. Prevention is better than cure. So if you have any ideas, and in whichever way you can be a part of it, please pen down those ideas and do help us to put it all together so that something productive comes out of it. I said I'm very goal oriented. I'm very, I must see the result of whatever we do. You know, it's a nice thing to discuss and understand each other, but it should result in the conference's idea being furthered, which is affordable and accessible healthcare. I'm not saying everything can be done free. In your own spheres, you can do what you want. However you want, makes it cheaper, accessible. That is also help done. And as they say, now in India, there is a missing middle. You were talking about that missing middle. Ayushman Bharat does not cover them because they're not as poor as those, nor they have private insurances which can take care of their things. So there are almost 40 crore people in India who are neither here nor there. They have fallen through the cracks. So they need a lot of help. Probably all these institutions put together can help that 40 crore while I work on that lower 50 crores. So there is a possibility of doing much more as corporates, as charitable institutions. And the key lies, we have nailed it, it lies in costing, lies in pricing and volumes. And India provides you with tremendous volumes. So I would ask you that if any of you would think that we should further this with the institution, we will do. In your own spheres, if you have local collaborations, that is also fine. But one thing that I can promise you is that this institution will generate the amount of data it will generate in the years to come. No other institution in India will generate across different specialities from all parts of the country. And this institution is definitely going to grow that way. Already we have that. What can we do about it to improve our healthcare systems, delivery systems, technology and everything? That is something again open to all of you. In your own way, you can come back and tell this is how we would like to use this opportunity, which helps, mutually it helps, which helps research and for the improvement of your services and products. It helps us because that will help us to reach this care to many more people. So I just want to ask that if there is an interest, please do get back to us and through any of these channels which are available through whom we have been contacted. And we look forward to a lasting partnership and collaboration for the coming times. And our aim is, I'm not even telling 2 years, I'm saying 25 years from now, I want to see in India, where I'm not saying people will not be born without diseases, because disease is a natural law, I can't do much about it. But whoever is having any disease also has access to healthcare. That's all we want to ensure in 25 years. And all those of us who are going to be around for 25 years, please think seriously about it. We want to see that India. So wishing you all the very best for all that you are doing. In some way you are impacting the country and the world. Please continue doing that. Also find ways to join hands with us. Thank you very much. Thank you, Mr. Rambabu, for conducting this. Santosha.
Much gratitude to Sadguru for such an enlightening and enriching experience. Also many thanks to Mr. Rambabu for voicing the right questions, many of which must have been on many of our minds. Thank you, sir, once again. We now request Mr. Venugopal Bhamdipati to render the vote of thanks, an alumnus of Sri Sathya Sai Institute of Higher Learning. He currently serves as Vice President, HSBC in Wealth and Personal Banking, and an active volunteer for all our service activities. Mr. Venugopal.
Very loving Sairam to all of you. At the outset, I would like to offer my humble salutations to Bhagwan Sri Sathya Sai Baba, and my reverences to Sadguru Sri Madhusudan Sai and the dignitary on the stage, Chairman Managing Director of Pulse Pharma, Sri Rambabu Garu, who's been a great support to this program. In fact, he helped us pen down the whole agenda and has been with us throughout this. So thank you very much, sir. I'd like to take this opportunity to thank all of you, the guests and dignitaries, people who are from the pharma industry, from the different medtech device manufacturing industry, people who are from the diagnostic chain industries, and all the different players of the healthcare industry. I think this is the first time that a coming together of this kind across different players from the healthcare industry is happening. Is being conducted by any charitable institution in this form. Is this what I get to hear from a lot of people, that this is the first time something like this is happening. So thank you all for taking out time on a Sunday when most people would like to actually spend time with their families. In fact, we have even representation from NGOs. We've got people from Rotary. We've got people from multiple companies, and thank you all for taking out time. I would also like to take this opportunity to thank some of the senior panelists who came at a very, very, very short notice, and especially people who have been consultants with Tata Trusts, Madhav sir, and people who kindly consented to actually moderate the panels, Rambabu Garu, Dr. Kariyappa, and Ramana sir, and so many of you who at a very, very short notice came forward and have made this happen and made this event such a successful conference. So thank you very much, sir, for taking out time. I would also like to thank our guests of honor. Again, Dr. Velumani, he's almost become like one of us now. So I took the liberty of actually calling him one day in advance to tell him that, sir, can you please do the keynote address, and he kindly agreed. So thank you very much, sir. Also, I would like to thank Dr. Sri Srinivas, sir, who actually pushed away a meeting with the delegation to another date just to accommodate for this particular conference and come and address us here today. So thank you so much, sir. I'd like to also lastly thank all the volunteers, all the staff of the hospital, and all the trust members and trustees who this has been a great coming together of different trusts under Sadguru's umbrella. This is probably the first time that we've had all these trusts coming together and working together for a conference like this, right from Sri Sathya Sai Health and Education Trust, which runs the hospital chains, the Prashanti Bal Mandir Trust, which is running the university and the medical college that is going to come up, the Sri Sathya Sai Arogya Vahini Trust in Bengal, the Sri Sathya Sai Sujala Shravanti Trust in Hyderabad. So all of these have come together to make this happen. Thank you so much for all the efforts that all of you have put in, and also Sri Sathya Sai Annapurna Trust, I shouldn't forget that, and they've been a great support to this activity as well. So thank you very much to all of you. I would also lastly like to thank Sadguru Sri Madhusudan Sai for conceptualizing and making this happen and giving us all the support to be able to conduct this. And thank you so much, Sadguru, for bringing us all together for a noble cause. And I'm sure that this conference, the ideas that have been discussed will be taken forward and will help us in not only the rural outreach to all the needy people in the different villages, but also to create young rural medical professionals. And that's the goal of this institution. Thank you all for taking out time for this. With that, I end my vote of thanks. Thank you very much. I would like to kindly request everyone to stand up for the national anthem so that we can close with national anthem. Thank you very much.
जन गण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे